Hello everybody. Constipation is a common problem. You can imagine that in the United States of America, the medical cost for taking care of people with constipation is something like $7 billion US, and the cost of only drugs used to treat constipation like laxative, something like $700 million a year in the United States of America. So this is a common problem and may reach to 30% of the population. Now, what's exactly constipation? By definition, if the stool is hard, difficult to pass, and you feel after that not satisfied, you feel that there is something more to empty, and it takes long time to empty the things. Sometimes there is abdominal pain, sometimes even headache, mild depression. So what are the causes of constipation? So the main cause is in your diet. If two things are missing, more fluid and more fiber, so if these two things are missing, so probably you are going to have constipation. The second point, to use drugs which causes constipation, like diuretic, like antacids, especially if it contains aluminum, drugs to treat epilepsy, drugs to treat high blood pressure, like calcium antagonist and beta blocker, drugs like antidepressant, and drugs to treat pain, especially morphine derivative and spasmolytic. The third point is that if there are diseases like hypothyroidism, that means the function is decreased of the thyroid gland, or autonomic nervous system neuropathy as a result of diabetes mellitus. Another point, if you have hypercalcemia, that means the calcium in the serum is very high, with the magnesium and potassium low in your blood. Sometimes there are temporary situations like pregnancy. Pregnancy, especially at the end of the pregnancy, because of the pressure of the uterus and the baby, or post-operative, especially if there are complications after that because of the long stay in hospital and long stay in bed. And sometimes the patient himself or herself refuses to eat or to drink, maybe because of dementia or psychological problem, or sometimes there is a psychological problem. For example, if the patient has anal fissure, so he has pain by defecation, so he tries to avoid defecation, and with the time he is going to have constipation, which aggravates the anal fissure. Another point is that especially when a person travels, then they have fear, or they don't like to use the public toilets because of hygienic standards, or especially by children. They want to play, and so if you ask them to go to the toilet, they refuse to make it. The second category of causes are the diseases which affect whether the gastrointestinal tract, like inflammatory bowel disease, for example, Crohn's disease, or irritable colon, or colon cancer, or anal fissure. Complication, yeah, if it is chronic, there are complications like hemorrhoids, like anal fissure, and like rectal prolapse, even diverticulosis. And if it is severe, especially in old people, it could lead to intestinal obstruction. So what is the treatment? To start with, I want just to speak about the toilet in Western societies. Usually it is really not physiologic, because to sit with a vertical angle is not good for the rectum, the last part of the intestine. So it is better to put something under the feet, just to elevate the feet and to make the angle between the thighs and the abdomen less. Okay, not like this, like this. okay? And this will reduce the tension on the lower part of the intestine, which facilitates emptying. But the main part of the treatment, to start with, you can forget drugs. Please try to drink water. Take fluids, at least 2.5 to 3.5 liters from fluids, especially if you are more than 50 years old. One, keep moving, keep physical activity. So in general, you have to make physical activity 5 times a week for at least half an hour. Third point is to take a lot of natural food fibers come from plants, okay? Because if it's high content from cellulose, and this cellulose is not going to be absorbed, not digested and not absorbed. So it makes a bulk, especially in the last part of the intestine, the so-called large bowel, and keeps with its fluid. So it facilitates with its bulk, and the high content of water facilitates the movement to the anus. So try to eat like the people in Mediterranean region. They eat a lot of grains and beans, olive oil, fish, and vegetables and fruits. So I advise to eat figs and chia seeds and dry prunes, very important, ginger, lemon juice, as well olive oil, and if necessary castor oil as well. If these measures fail, then we can take drugs, laxative, to facilitate the movement in the bowel. Sometimes it may be necessary to visit the doctor, especially if you have 4 points. One is anemia, second is general fatigue, third is blood in the stool, and the fourth, too much weight loss. So in this case, you have to go to the doctor because it could be serious. For example, colon cancer. Don't forget to drink a lot of fluids and to keep on moving, keep on doing physical activity, and to eat natural fibers. I hope you stay healthy. If you see me for the first time, please subscribe to the channel and try to distribute this video to your friends and relatives. Have a nice day. Goodbye.